My name is Matthew Peters, and I'm a mental health counselor at Providence. The work of a mental health counselor is focusing on the mental health of patients and clients in the hospital. A lot of my work as a mental health counselor in Providence is running groups with teenagers in the PCCA where I work. And I conduct DBT groups, which is a form of therapy, and I teach skills and techniques so patients have tools to work with outside of here. How my day flows here at Providence is I show up to work about 3 o'clock. We meet up for a report and learn about all our patients, what happened prior to our shift. So once we are on the unit, we have a schedule for our patients that kind of sets up the day for groups, gym time, dinner, relaxation, and of course bedtime, snack times. All of them just to kind of keep a structural flow on the unit. Some of the most common skill sets that I've seen in my work is empathy, unconditional positive regard, active listening, and patience, a lot of patience. To become a mental health counselor, there's different levels of it. My level, being in the hospital, requires a bachelor's, so a 4-year degree. A licensed mental health counselor that is licensed to do therapy one-on-one or group setting or other settings, that requires at least a master's degree, so a 6-year plus degree. I thought my experience at Eastern was wonderful because you're surrounded by professionals, especially in the psych department, that have experience in the field, not just being professors, but having therapy experience, research experience, and they all share their knowledge with you. They kind of embody the counselor model itself and push it back on all the students so they can kind of get a taste of what counseling kind of is. I felt like Eastern Washington set me up for success in my field. If I was talking to middle schoolers, high schoolers about working as a mental health counselor, I would tell them the positives of working in this field is that you're helping a lot of people. You're taking time out of your day, you're sitting down with these patients, these clients, you're showing that you're genuine and you're making these connections and you're kind of being a good role model. And that's the positive, but I say on the flip side, it is kind of draining because sometimes we need those same models in our lives and we don't always get that. So it's kind of being aware of your own mental health as you're helping others. Sometimes when I think of like the field of mental health, I think sometimes we're not giving enough attention to it, and it's a huge part of our life. And I think with more and more people going into this field, they kind of get a better understanding of how people work, how we think, how we feel. And I think that's the future. I really do. So I would encourage anyone that's, wanting to get into this field to definitely jump into it and see what it's all about. When I see a patient, I don't see a disorder. I see the patient and I see that they're struggling with something, and I think it goes back to just being compassionate and giving them that room. And I think that's what it's all about. It's just getting rid of that stigma and shining light on this.